I've been around a few places that you know, I think they used to be called places for the criminally insane type places. You know.
Hospitals here.
Oh, forensic, is that what they call them?
Hospitals.
Yes. And you get the impression that in some cases, you know, people are being, you know, a lot of therapy is going on. And there's also a problem with therapy. You know, what is therapy? It comes back to your line of business.
For cognitive behavioral therapy, it's working with their thought patterns to adapt more
Yes.
sustainable ways of thinking, like better
Yeah.
to adapt to stuff.
Yeah. So you have that maybe going on in an institution, but then you also at the same time are very much aware that medicine plays a very important, so you know, people's minds get totally that's the word, yes. What worries me more are the people in prison who have mental disorders. That's more important, I think, and why they're not being sort of dealt with, not in prison. You know, why they're going into prison when they need to be helped.
How would you propose they will be dealt with?
Yeah, it's a good question. It's not entirely clear whether going into another institution is going to be the answer, but there is the possibility that community work is much more useful.
I understand that, like, in the United States, like, all this gun violence, a lot of people attribute it to mental illness. It's a sort of mental concern as opposed to a gun concern, but that, neither here nor there. There seems to be huge stigma attached to mental health patients in the US.
Yes.
Is that the same can the same be said for cases in the UK?
I would think it is, yes, I would think it is. I've not heard the one about the gun. My parents used to live in America, and I mean, they were extremely religious people. You know, I'm talking really serious religious, and so you know, they'd probably go out and kill somebody who wanted an abortion, for example. But at the same time, were very much in favour of executing people if they'd done something wrong. I mean, not just wrong. I mean, some serious offence. The problem with executing people, of course, is that very often you're executing people on occasions that have not committed that crime.
Were you in Texas at the time?
In where?
Were you living in Texas at the time?
No, I wasn't. I've never lived in... I went to university in Chicago, and that's pretty scary. But no, it's just this interesting condition almost of the mind where, I mean, you're talking about your own parents who, you know, would kill if somebody agreed with or carried out a termination, but who, because it's the sanctity of life. But at the same time, if something came on the television and it was somebody who'd, you know, had committed a crime, serious crime, I'd kill them, you know, I'd execute them. So there's a lot of that going on in America, more so than I've noticed anywhere.